This is the Marquise probe, and we will be using this in the video to probe. It is measured every 3 millimeter increments all the way to 12 millimeters. This is the UNC 12 probe, and it's measured every 1 millimeter increments, and I believe we will be using this later throughout our program. And this is the NABUS probe, which is used to measure the frication between molars. It is also in increments of 3 millimeters. All of these probes have their own primary function, as the first two, the Marquise probe and the UNC 12, are used to assess the health of the periodontium and other functions such as clinical attachment levels, recession, the width of attachment, the size of intra and extraoral lesions, bleeding areas, determining the mucogingival relationships, and to monitor longitudinal response of the periodontium to treatment. To measure the width of attachment, you will want to start measuring your probe from the mucogingival junction, which on the Dexter is a little bit hard to see, but with the photo here, hopefully it helps visualize a little bit better. And from that point, you will measure all the way up until the gingival margin, and that's your width of attachment. And it's also noted that if it's less than 2 millimeter, it's noted as inadequate attachment, and if it's less than 1 millimeter, it's noted as no attachment. To measure the clinical attachment loss, it's a little bit more complex. You will have to first determine your probe depth, and then determine if there is a gingival overgrowth, if the tissue looks normal, or if there's recession. In this photo here, it kind of goes over the recession, overgrowth, and normal readings for clinical attachment levels. Determining based on if you have overgrowth or recession, you would add or subtract from your period probe and determine the clinical attachment loss there. Here's a photo I took in clinic just of a Dexter, just pretending to measure the recession here. For recording the recession, you were measure from the gingival margin up until the CEJ, where the cementum and the crown kind of meets. Here's a video of me in clinic just probing on the Dexter model. This is on the lingual of number 8. Just making sure you're adapted to the tooth, just walking in 1 millimeter increments along the JE. And here we're starting from the buccal of number 14. And here we're moving to the lower on number 24 facial. And then here we're moving towards the lingual of number 30. Just making sure we keep the pen grass, keep that fulcrum nice, and using the denomer to retract the tongue. And then here on the EagleSoft Perio probe, where you can record your depths and your bleeding and separation. The red circle is noted for bleeding and the yellow is noted for separation. Here in this photo here on the bottom, to measure mobility, you will use 2 blunted instruments and slightly move the teeth back and forth just to note if there's any mobility. For class 1, it would be anything under the 1 millimeter movement. Class 2 would be anything over than 1 millimeter but less than 2. And then class 3 mobility is anything greater than 2. It could be a vertical displacement or horizontal mobility. For our furcation classification, the image to the left is noted as class 1 furcation, where your neighbor's probe, you can feel indent when you're exploring in. For the image in the middle there, I would consider that class 2 furcation, where you're able to get your neighbor's probe through partially, but not all the way through. And for the image to the right, I would consider that as class 3 furcation, where your neighbor's probe can go all the way through. There's also class 4 furcation, which it would be similar case, except for clinically you're able to see the gap in between due to recession and bone loss. And on radiographs, you're able to see class 3 and class 4. And lastly, I just want to finish up with talking about the other use of the probe, which is to measure lesions inside the mouth and outside of the mouth. You are also able to measure the open contact. First, you would note with a floss and see if there's any open contacts. If so, you could use your probe and measure that.